Our final panelist is Mr. Steve Kirsch, who also joined us last year. He's a former Silicon Valley high-tech executive. When the pandemic started, he created the COVID-19 Early Treatment Fund. Thank you for doing that. To fund researchers working on repurposed drugs. Mr. Kirsch has also testified before the U.S. Senate and presented, as I mentioned, here last year. Welcome back to Pennsylvania, sir. Over to you.
Thank you, Senator. We're, I guess, over half an hour over, so I'll just be brief. I had a lot more to say, but in the interest of time, I'll cut to the chase. I'm going to talk about the elephant in the room. This is the biggest thing that we should be discussing that nobody has talked about, which is that all these vaccines are causing harm to our kids. It's not just the COVID vaccines. It's every single one of them. There has never, ever been a study comparing the fully vaccinated kids who follow the CDC schedule versus kids who have not been vaccinated at all, who did not get a vitamin K shot, which is not a vitamin, and whose mother did not get vaccinated. If you compare the results of kids whose mom didn't get vaccinated, no K shot, and no vaccines, and if you compare the outcomes of those kids versus kids who got the CDC schedule, there is a dramatic difference. It is an unbelievable difference. It is a difference that nobody wants to talk about. There are no studies, zero, that show the opposite. When you talk about you shouldn't be discriminated against because you didn't get a vaccine, you should be applauded because you didn't get a vaccine, because you did the right thing. If you're a parent and you didn't vaccinate your kids, you should be applauded because you did the research. We have like a 60% rate of people with a chronic disease in America. If you've not been vaccinated at all, the rate is close to zero. And of course, none of this is talked about. They tried to get the CDC to do a study of the vaccinated, fully vaccinated versus the fully unvaccinated. In 2005, CDC Director Judy Gerberding promised to do such a study. She said, yes, we should do such a study. It's important that we do a study now. We can refine it later. And that was nearly 20 years ago. And that study has never been done. And it will never be done because they don't want people to know that all these vaccines have been harming people since the very beginning. There is no safe vaccine, not a single one. They do not want to know whether the vaccines are safe. No state has ever done a study showing the vaccines are even safe, where safe kills fewer than 1 person per million. No country in the world will release that information. When I try to approach other countries to release that information, the record level vaccine safety information, they refuse. They say, well, it'll be a violation of privacy. No, it's not. I've released the Medicare data on my site and nobody complained. Not a single dead person. I did not get a complaint from a single dead person about violating their privacy. It's amazing. And yet these records are hidden. When they said, well, there'll be a privacy violation, I say, well, here's how to get around that. And then they stop talking to me. The conversation goes up until then. Or they say, yes, we could do that, but it would be expensive to do. And I said, I'll pay for all the costs. And then they stop talking to me. Do you see a pattern here? They don't want you to know. You look at the Amish. I did the calculation. Let's say there were 5 Amish people. Because people say, I think there were maybe a few, or maybe there were 5 Amish people. But you know, and then I asked for them, okay, can you name them? And nobody can name them. But let's say that we could name them. And there were 5 Amish people who died. That means the Amish died at a rate 90 times lower than the infection fatality rate of the United States of America. Now, how is that possible? It's possible because the Amish aren't vaccinated. And because the Amish didn't follow a single guideline of the CDC. They did not lock down, they did not mask, they did not social distance, they did not vaccinate, and there were no mandates in the Amish community to get vaccinated. They basically ignored every single guideline that the CDC gave us. Ignoring those guidelines meant a death rate 90 times lower than the rest of America. So you talk about taking guidance from the WHO? Why don't we copy what works? In fact, wouldn't it be great to say in the next pandemic that Pennsylvania will take guidance from the Amish instead of the WHO, and you will be much, much better off.
We want accountability, and where do you see that headed?
I think you're not going to get accountability until people wake up, until people realize that they've been lied to. And I think the biggest wake-up call is autism. We have an autism epidemic in America. I just did a survey. 22% of households I surveyed have one or more autistic kids. There are about 100 top researchers in the world on autism. And one of them reached out to Dr. James Landis-Weiler, who wrote a book on autism, and he thanked him for writing the book. And he mentioned that, you know, all of us top autism researchers, we all know that vaccines cause autism. We're just not allowed to talk about it. And that's why we have an autism epidemic in America, because they're just not allowed to talk about it, because they would lose their NIH grants, they would lose their jobs, they would lose their license to practice medicine if they spoke the truth. They tried to do that in the Senate. They tried to call William Thompson at the CDC, who was ordered by his superiors at the CDC to destroy all evidence linking vaccines and autism. He did that, but he kept a copy. Bill Posey, Congressman Bill Posey, tried to bring him to testify under oath in Congress, and he was denied. They would not let William Thompson testify in Congress that he was ordered to destroy all data linking vaccines and autism. They're just not allowed to talk about it. Now, subsequently, there was a bill in 2009. There were 9 members of the House who co-sponsored the bill. That bill died in committee. That is the stranglehold that the drug companies have on America. They don't want people to know. There is no data transparency here. Public health data is not transparent in any state of the United States of America. It is not transparent in any country in the world. The Amish are a perfect example of a large group of people who are largely unvaccinated. And there's no we can't find an autistic kid who was unvaccinated. It's very, very rare in the Amish community, very, very rare. You won't find kids with ADD, with autoimmune disease, with panda pans, with epilepsy. You just don't find any of these chronic diseases in the Amish. And you know, the US government has been studying the Amish for decades, but there's never been a report out to the public. The reason, of course, is it would show that, oh, if you don't follow our guidelines, you're going to end up healthier. That's why there's no report after decades of studying the Amish. There's no report, because the report would be devastating to the narrative. It would show that the CDC has been harming the public for decades. Now, there's another facility, and there are a bunch of these. There are probably fewer than a dozen. We don't even know the exact amount, because they all have to fly under the radar. Because if the medical boards ever found out about any of these physicians, they would destroy them. They would take away their license. So there's one facility I'm aware of. It's been operating for 25 years inside the United States somewhere, and I know where. They've had thousands and thousands of kids. And parents are dying to get in to these practices because the health outcomes, there's 0 autism cases in 25 years. Wow. They're in a community which is surrounded by autistic kids. In all the other clinics which follow the CDC guidelines, the autism rates are off the charts. In this clinic, which is surrounded by these other clinics, there's no autism. 0 in 25 years. 0 cases of autism. The only cases of autism they have are people who come into the practice late whose kids were already vaccinated. Those are the only cases of autism. Nobody who follows the no vaccines. And so, parents are at first reluctant to do that because they've been saying, oh, what if my kid gets, they could die from measles, mumps, whatever. No. We have protocols. If your child gets one of these diseases, we know how to treat them, and their immune system will be able to cope with it because they haven't been vaccinated. But you see, the doctors know, and that's where the doctors send their kids to this clinic. But they don't talk about it because they're not allowed to. It would be too embarrassing if you're a doctor and you sent your kid to a clinic which doesn't vaccinate. Look, the doctors, I talked to a doctor who makes about $500,000 a year, and he said, I could make $1.5 million a year if I vaccinated all my kids. He gets a $1 million reward if he vaccinated 95% of his kids or more. $1 million.